everyone, this is Farah and I am here at the Health 2.0 Conference Dubai. I have here with me Mr. Nandhavignesh Ram. Welcome. Can you please introduce yourself and your organization?
Myself, I'm Nandaram. I'm based out of Bangalore. I have a 14 plus years of experience on a multi-cloud architect. So I've been working for the big names like VMware, Dell, and also for Microsoft. So after that, there was a vision of my wife's. She wanted to have a company, something like where the interoperability is not there. We identified some kind of a gaps there, and she wanted to solve that. So I've been here in our place to solve those issues, and we wanted to have as a complete product. When you have a market and you have a product, you need to create a roadmap and milestones for that. So that's how everything has been created from there. So I started pursuing for her dreams, and it has become. I'm a basically techie guy, so I was always involved in a lot of kind of technology to be interrupted or integrated with whatever I was doing. So we had an idea of integrating the NFC technologies and the blockchain together. So where I was also working on the blockchains with the blockchain identity, like self-sovereign identity and all. So once you put all together, we had a different idea, and it was completely unique. And we tried approach, right? We had an opportunity of letting us know that this is a unique idea where we have to file a patent for that, and we did it. Once we filed the patent, and we got a lot of things like piled it up with us from the hospitals and doctors. They wanted to understand how exactly it works. So we have to completely market it in a way as a commercial product is entering into the market. So then we started analyzing the market for 3 to 4 months of time, and we had a supportive team, and we have had a NGO supports. So through the NGOs, they were researching on DNAs, genome projects and all. So everything has been connected all together, and we were able to identify a lot of gaps to that, where there are a lot of fragmented data. So there, say a patient, if he is going to the hospital A, there itself he is having multiple records, and B, another multiple records. So when you try to solve or give a personalized treatment for an individual, it's very difficult with the fragmented data when you see that. So that's where we got the blockchain identity for each and every user. And then we connect and give the softwares for the healthcare ecosystem, like we'll be able to connect the hospitals, pharmaceuticals, and the blood banks, and also the other healthcare laboratories and all. So everywhere, an individual will be having a alphanumeric unique identity that will be called as a blockchain identity, and he can log in using the Emirates ID or the other ID. His complete profile will be popped out with that. He doesn't have to do anything. It's a single text operations, and every patient will be given an NFC card, and the hospital will be having an NFC validator, and the software is completely be only they have to invest just one time, and that's how everything is started. We already connected with 17 hospitals in Bangalore. It's already on places, and we have a large scape with more than 50,000 people enrolled in it. We also have a student program which we are launching it soon, and we have a complete AI system at the back end which is helping us in a beta version, but that is doing a phenomenal job. We have to really agree, and we have named the AI system as Avatar.
Thank you so much for this introduction. I'd love to congratulate you for the Outstanding Leadership Award. Can you share with us how it felt to receive that?
It's a organizational exceptional award for the organization which I received, and I really appreciate the complete teamwork it is, because it's not the individual. When you talk about a complete entity, we are working together, and even when we call in the night times, which will be uncomfortable for anyone, but still the people are ready to do the research works, and they come up with new kind of ideas how to approach the markets and how exactly we'll be able to tackle the next kind of roadmaps, and the deliverables has to be on time. Even if there is some kind of delays, we have to catch hold of the customer to make sure that this deliverables is going to be reach him, and then we are going to roll out the new operations over there. So it's a complete team effort. I would really appreciate it, and it goes for them.
Congrats to you and to your team as well. Now I'd like to know about your experience at the conference so far. Were you able to network with people here?
Of course, it's just 2 days from yesterday onwards. It was a surprising meeting for the panelists along with me, but he was very much interested in the topic what I was discussing. His name is Andre. He is from Sweden. So he is working on some kind of technologies where if you scan your retina, he'll be able to identify what kind of cancer that you have. So that's the technology he has. But again, he's also very much interested to know about the blockchain, because he is suffering from a lot of fragmented data. So that's where we got into the picture. And before just going to the stage, we got to know all these things in 5 minutes. And after that, we went on to the stage. It was completely improvising, and he was able to ask some questions to me and me to him. It was really nice. After coming down, right, he has never left me until the day was completely over. And I got another, so many people who are connected here. It's been like more than 16 or 17 companies, yeah, until now. Even now, one person is talking to me, so he was pulling out, so I thought I have to come down for this interview. That's how it's going on. It's very phenomenal for me.
That is incredible. We're so happy to know you're having a very, successful engagement here. Now, if anyone would like to reach out to you or find your company, where can they find it?
So we have our website details everywhere, and right now we are not completely on the social media networking. We are not publishing it as we are working on B2B. And once our AI system is completely full-fledged, and we'll be launching on the application to the public, general public. Right now, the hospitals which we are doing it, right, they are also asking for the white labeling. And now we are connected with Dubai Emirates TPA, and we are checking with them. So what are the procedures to enter into this market? Because there are many legal things which need to be followed as per the Dubai government. And today we got an opportunity to discuss with some of the other contacts to establish and move it into Singapore. So that is also on progress. Yeah, it's very surprising for me, but yes, we are happy for it.
That's amazing. I wish you the best of luck with all of this. Thank you so much for your time and congratulations again.